What if relief from stubborn pain didn't come from a pill bottle, but from a prescription grade cream trusted by doctors across the country? I'm Dr. Tammy Penhollow, a physician who spent decades helping people get out of pain and back to motion. And today I'm joined by Kristy Jensen, the Chief Growth Officer of CBMD, a physician founded and led company redefining how we use topical CBD. If you've ever wondered how a CBD cream can actually work, what makes a medical grade formula different, and how it's changing lives, you're about to find out. Kristy, I am so glad we finally got together to get on this podcast. Welcome to Mobilize and Energize, all things about staying out of the operating room and keeping people in the game of life. Please introduce yourself and tell us why CBMD.
Hi, it's great to be on your podcast. Thank you so much for inviting me. I'm usually on the other side of this, so I'm getting hazed today, and I'll have a deeper appreciation for what I do to you and so many other doctors when I'm reviewing our product. So CBMD is a very unique CBD brand. We are a company that is led, our formulation was formulated by a team of practicing physicians. We have doctors that are experts in pain science and musculoskeletal conditions. Our formulations are grounded and rooted in clinical understanding, not just marketing. We found that back in 2018, when the U.S. Farm Bill was passed, the products were really flooded. The market was flooded with a lot of marketing gimmicks surrounding CBD. There were a lot of sole practitioners masquerading as CBD experts. There was a lot of people that just wanted in on CBD and the profits from that. And so our team of physicians found a unique opportunity to not only provide their patients with a natural option, with one that was rooted in science, but also backed by third-party testing, strict manufacturing protocols, and quality-sourced ingredients.
So let's touch on that third-party testing. That means that you don't just have your lab take a sample and test it and say, oh yeah, there's actually what it says ingredient-wise in it, and what's not in it is not in it. It goes outside. So this is somebody that is third-party, meaning they have no financial interest. They have no benefit in saying that the product is less than what it actually is or more than what it actually is.
Exactly. And that's critical for us and for other clinicians and patients to know that they can trust our brand, is to make sure that we remove those barriers, put that wall up between our company and the testing lab. So yes, we're third-party lab tested. Every single batch has a QR code on the packaging that both patients and clinicians alike can go on, type in the unique badge, the code for each individual batch, and then produce that third-party COA lab test on the website. We will produce that for you so that you can assure that what you are taking is void of THC, that there's no trace amounts of that. And that's where we really fit in with the clinician space. We have pro teams, we have Olympic athletes, we have a lot of government workers, the weekend warriors that can't test positive for THC. And that's really important to us that we purify. We use broad spectrum CBD from USA hemp, which already by nature is less than 0.3% THC in broad spectrum hemp. However, that's not good enough for us. So at 4 different stages of manufacturing, we further reduce that to leave no trace at all. We test for heavy metals, pesticides, microbial contaminations. We purify it, we reduce it so that it's water soluble. We also add botanicals, arnica, menthol to allow for that initial cooling effect, and also to have all those components based on clinical research have the most impact to support with pain and inflammation.
It's above and beyond what everybody else has done. And if you are a government worker, you're a police officer, you're active duty military, you're a physician, anybody who's getting drug tested, that you don't have to worry about this, and yet you can still have some relief. It hits the endocannabinoid system. It's not on the opioid spectrum. It's not going to cause a dependence. It's not going to cause the things that come with, say, smoking marijuana, where there can be the hyperemesis or there's a dependence or those all these things. THC is a totally different drug than CBD. And I really love that that's available to our patients. Can you share, not without divulging names or anything, but kind of some success stories that you've heard of? And I can absolutely share my own personal experience.
Yeah, I would love to. I think these stories just, to me, further solidify the safety, the predictability. Our patients love that it doesn't have systemic absorption so much so that it affects the liver or burdens the GI tract. And that's what's so great about a topical is it's more of a localized impact on the body. So as you mentioned with our endocannabinoid system with CB1 and CB2 receptors, that's what CBD is impacting, both the brain, nervous system, peripheral tissues, immune system. It modulates these receptors to reduce that pain and inflammation. And so, I mean, I would say for me, our favorite stories are always the weekend warriors, the person that's saying, you know, hey, I work 8-hour days. I have to sit at a desk. My back hurts. This helps me to manage just sitting in the chair. I've had women call me and say, I'm using this for menstrual cramps. I'm putting it on my stomach or on my back when I'm experiencing menstrual cramps and it's helping. I, of course, have my personal story, which I'll share with you. But one that just recently came to me was an office manager for Dr. Fawad Mian's clinic in New Jersey, Tamra. He is an amputee and he's been on opioids for several years, which causes issues with driving, working, lethargy, digestion. And he said that he had tried the cream, took about a week. Typically our patients, and this is why we provide our doctors with enough sample or enough product so that they can apply on patients in clinic, because often it works quite quickly. But for those more acute issues, or for Tamara's case, being an amputee, it took about a week. He noticed, okay, a little edge was coming off of the pain, but he kept with it. 2 weeks, 3 weeks in, no pain. His phantom pain was gone. He's been off opioids now for almost a year. So it's these stories that are just so heartwarming for me to know that we can provide something natural for patients that aren't a problem with their GI tract, livers, and all of that. It's a natural option for them to use. So that's an incredible story. I get them all the time from our celebrity singers that are going on tour and their dance team that they just won't travel without our product. Our professional teams, they're doing, PT, athletic trainers, they're physios, they're doctors. They're all using the product to help the patient or the athlete. For me, what brought me to CBMD was I'm a pain patient. I had a back surgery in 2018, a microdiscectomy and a laminectomy, which cured my initial pain. I was bedridden on and off for several years after having my 4th child. And the last month before my surgery, I was flat on my back in excruciating pain for over a month. Couldn't take care of my children. The opioids they were giving me wasn't working. And I know the issues with opioids. I did not want to be on them, but I was trying everything. I was trying acupuncture. I have all the tools in my bedroom that you can imagine, the massage chair, the Theraguns, the bands, the everything. I tried it all and they would take a little edge off. And to me, that's worth it. But the pain got so bad and I was not functional that I had to get this surgery. And so initially it helped me. But then, of course, as you would imagine, I started having issues on my other side because that side of my disc and spine were now compromised because they cleaned it out. So then I started having sciatica again and felt arthritic every time I got out of bed. I have stenosis. I have lower back arthritis. I still have disc bulges and I stay in shape. I work out 5 days a week. I do all the things. I'm careful. I don't sit very long. Every hour I sit down, I stand up, whether it's in a plane or in my office. And this company came to me after I had worked with several of their doctors before, sent me their product. And I thought, okay, this has got to be snake oil, right? I mean, that's the problem with bad players is that I've tried over a dozen other CBD topicals and they might smell good, but they leave a residue. They're not water soluble. The menthol is a little overpowering. So I said, okay, I'll try it, but I was pretty cynical. So I applied it on my back before I got out of bed. Typically it takes me 15, 20 minutes of stretching and everything to get out. Put it on my back. 5-10 minutes later, I didn't do my stretching. I got up and was like, okay, something's happening here. This has got to be placebo. There's no way something's going to work on me this quick after all the money I've spent and all the time I've spent on therapies. I consistently used it and it's helped so much with all of those aches and pains and when I'm inflamed. And I still incorporate other things. I still get my shockwave. I still do my PT. I still make sure my workouts are proper for my body and my issues. But now I feel so empowered being able to travel. I bring my baseballs to roll out on and my CBD cream. And that kind of keeps me held down between my physician visits with the shockwave and the laser and all that good stuff.
That's amazing. Two things. You can definitely smell somebody coming if they've got a bad product. Some of those smells are just outrageous. I will laugh at that with you. And the aspect of being able to incorporate this into a whole thing. It's not the thing. It's not going to be the one and only, but it is an adjunct. And altogether, we can take a notch off, take a notch off, take a notch off. And I love that you've set that straight too.
Yeah, absolutely. And that's the goal. We're not claiming we're a miracle cream, although we've had patients call and say, this is a miracle cream. Okay, great. We're not claiming that. This is just an adjunct to your treatments as a physician or as a patient, as you still are empowered and taking responsibility for yourself and your health. And for us, we are confident that we outperform any topical in the market, including prescription. And this is why we offer all clinicians a free sample if they want to try and compare and contrast to anything else that they're trying so that they can offer their patients the best product.
And I have it in the office. I do what you say. Usually I do a physical exam that may stir up the pain. I'm not intentionally trying to get things aggravated, but to put the patient into the positions that cause pain or palpate around the knee and right on that inside aspect where there might be that meniscal tear. So at the end, as kind of a peace offering, I do put that little tiny bit of CBMD cream over the area. And by the time they've gotten back dressed and sitting down and we're talking about their treatment options, that they've calmed down. It has gotten better. And they're like, oh, what did you put on me? That really helped. And so I love that it's a kind of a try before and get to see what it can do. It is fast. It is within 5-10 minutes and it can provide that kind of relief. Can you overuse it? Like, can you use too much during the day? Or what if you say, that's great, you put it on your back, but I hurt from the base of my skull all the way to my tailbone and my knee is hurting. What kind of prescription grade restrictions are there in a person applying this cream?
So what we do know about CBD is that it has a broad safety profile, especially when it's void of THC. We have, and that's part of our quality components, is that we have specific dosing and it doesn't take very much. It's a nickel size per area twice a day. If you have 10 areas, that's okay. I had some of our pro teams over in Europe. They called and said, okay, at what level is there an overdose or an issue? Because their athletes are being treated head to toe. I have those same issues too. We've not had an issue with a CBD overdose. Again, there's no psychoactive effects in this product. It's very, very safe. You're just spending more money. That's not necessary if you're putting too much on, and it's okay. I guess you'll be doing backflips tomorrow. But yeah, it's broadly very, very safe. There should not be a concern. I think somebody in our company made a joke. I think you'd have to drink our 32-ounce pump bottles every single day for 30 days before you have an issue. So it's very safe. It would be very difficult for any kind of overdose situation in a
Wonderful.
product that's broad spectrum topical.
And because we know what's in it, because of the third-party testing, we know that then it's not going to be a lead poisoning or a THC issue where there is psychoactive. This is pure CBD plus the arnica plus that little peppermint. It just is so nice. And I love that you've incorporated arnica too, because it's a homeopathic and for muscle aches and bruising and all those things. So it's just a really nice combination.
Absolutely. Yes. We're super excited because the product has done so well that we're actually involved in a large clinical study that's underway right now. This company that I cannot mention right now because the study is underway. We don't want to give out who the placebo is and who the CBD product is, but they are doing a large study with commonly used diclofenac with our product and a placebo. And we're super excited to get those results back. And this all started because their surgeons said that this product was outperforming their prescriptions that they were giving to their patients. And they wanted to offer, patients are now gravitating towards natural products. A lot of physicians don't understand. Patients are exploring CBD outside of their care. And patients, it's a complex system. CBD is complex. The endocannabinoid system is also complex. We know a lot more about CB1 than we know about CB2. And so where there's gaps, we say that. We err on the side of caution. And we want to make sure that our clinicians that are using our product know that our medical team, our practicing physicians that have done the work, they've done their due diligence to make sure that this product is what it says it is and performs the way we say it performs. So we're excited for that to come out. And I think that will make a big, big difference and help us with our growth too.
Absolutely. I'm super excited too. And I know sometimes people come in to me and they'll even bring a bag of different creams and salves that they've tried. And some of it you get at the gas station store. Some of it you get in a farmer's market. You just don't know what's in it. So when I bring up the topic of have you used a prescription grade topical CBD, they're like, oh, I've tried like 15, 20. No, have you tried a prescription grade with third party testing? It's a completely different product. So I think that that's super important for us to emphasize here.
Yes. And it's so frustrating because pain is so multi-layered. It can be so debilitating, so depressing. I mean, when I went through my pain journey, and it's still not over, there are times where you feel like you are not who you are. It is so confusing and so frustrating. And what works at one point doesn't work again. We know the problem with cortisone injections, especially long term. That's not the solution. It's a terrible Band-Aid. And it just, to have something that I know is consistent for me, that I can rely on, is so empowering. I mean, there was a time where I wouldn't travel. I couldn't go on airplanes very much because I was afraid I would get stuck on a layover. And if I was sitting for more than 2-3 hours, I was going to struggle standing up. So to know that it just empowered me, and it's empowered so many patients to be able to just get through their day-to-day activities.
Absolutely. And I said I'd tell you how I've used it. I'm a orthobiologic or a autologous cell therapy, platelet-rich plasma, bone marrow, aspirate concentrate patient, as well as the person who offers that to my patients. So I've had lateral epicondylitis from pickleball things. I've had a rotator cuff injury it ended up going on to a surgery. I've used it both pre-op and post-op. And I, like you, have had some disc issues. I actually had tears in my discs and went and had bone marrow aspirate concentrate into my discs, but getting me up and to the point where I had the procedure and through the point, and then just occasionally here and there, if I do something overdoing in the lawn or lifting objects, then I'll apply that tiny little amount. And I say it's more like a little garbanzo bean size. It is a tiny little amount that spreads all over the place, and it is just wonderful. I typically apply it twice a day. I say to my patients they can apply it more if they need to, but typically I find that twice a day is great. So it can be economical when you're talking about not them buying all the over-the-counter things, not buying the latest gadget because this makes you well enough that you don't need the gadgets, etc. So I really do like that there is value in the product as well.
Yeah, and I think what's great about the different sizes we offer, I have found the vast majority of patients use it for a week or two, religiously, a couple times a day. Once they have control over their pain, then it's as needed. Okay, it's a little maintenance dose. It's a maintenance application once a day or every other day or every third day. It's just an as needed. So those tubes can go a really long way, especially given that it does not require a large amount. It's kind of like the ibuprofen. If someone's getting a surgery and is recommended an ibuprofen, you're not going to give them 1,600 milligrams. That's not, at that point, you have diminishing marginal returns. And that's what I love about this product is I don't feel the need to take excess amounts. Just a little goes a long way.
It sure does. And you do have a couple different sizes that are available on the website. We're going to give the website, we're going to give a special code to our subscribers and our listeners for this, but there is a 1 ounce and there is a 2 ounce. The 2 ounce is double the 1 ounce. But essentially, if you're applying it twice a day, this is about a month. And this is about half a month. But like Kristy said, if you use it religiously for the first couple of weeks, this could get you to a month because then you don't need it every day. So I do like that about it as well. What have we missed? What do we definitely needed to tell everybody about, particularly about how to find the product, how to know that it needs to come from either a physician office or online? You can't just find it in a store, those kind of things.
Yep. We are available in clinician and wellness provider clinics. Also, our website, cbmd.com. For your patients, I would recommend they get it either straight from your clinic or through the code that you're providing them. It's just Penhollow. You would just go on cbmd.com, type in Penhollow. We'll also give you a link that you can provide that'll populate them straight to it with the code just being applied to their checkout. And if you have a clinician, if you go on our website, there's a clinic finder. If you find your practitioner is not carrying the product, recommend us. We're happy to send them a free sample for them to try and carry it in clinic for you.
That's wonderful. Thank you. So, Kristy, I want to thank you so much for sharing this incredible work happening at CBMD. I can't wait for the clinical trial to complete and be published so we have the data. For our listeners, you know what to do, cbmd.com, and use the code Penhollow, and you will get a very special discount because I love the subscribers. I want more subscribers. So if you found this episode have helped you, hit subscribe, share with a friend who's in pain and is struggling with that, and leave a quick rating. So until next time, keep moving forward. I'm Dr. Tammy Penhollow with Kristy Jensen of CBMD, and this has been the Mobilize and Energize podcast. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.